This maltese presented with erythema, alopecia, pruritus, and crusting at the base of the tail, in the dorsal aspect of the body trunk. Typically, this is caused by any form of irritation, like a prick from a thorn or a wire, maybe when passing under a wire fence or passing through the wood. Then that point becomes a source of infection, such that the wound will start spreading. Now, as the wound spreads, it causes itchiness. That itchiness causes the dog to scratch more. The more it scratches and bites at the wound, the more it spreads. Now, because of contact with the fur around it, which has got high percentage of bacteria, that wound will keep increasing further and further until to form a big wound, like in our case. Treatment wise, you have to clip off the fur from the affected region and include normal tissue. After clipping off the fur, cleanse off the surface with some dilute antiseptic like chlorhexidine, which may come in form of Savlon, or you can use Dettol. After cleansing off the surface with an antiseptic, we've got a variety of topicals that you can apply. One of them is Silver Lab, which is good for wound healing. The second option is For Sure Cream, which is a combination of an antibiotic, anti-inflammatory, and an antifungal. Another topical that can be applied is gentian violet paint, which assists with limiting infection on the wound. This can be done once or twice a day. To increase the possibility of wound healing, you can put an Elizabethan collar or buster collar on the dog so that you reduce scratching on the affected region. After a week or so, the infection would go and hair will start growing back on the affected region. In severe cases, the dog might also present with a systemic infection characterized by lack of appetite, lethargy. In such a case, we would also need to institute some systemic antibiotics like cephalexin, cotrimoxazole, amoxicillin, etc. This can be given over a period of 5 to 7 days, once or twice a day, depending on the dosage. You can stop applying topicals once wound healing ensues, usually within 4 to 5 days. Operatively, the dog can be kept indoors for as long as possible. 2, you can put the dog in a buster collar to prevent excessive scratching and biting at the wound. 3, prevent other dogs from licking that affected region. In cases there might be secondary infection with fungi. In such a case, you may institute oral anti-fungal medication like fluconazole or ketoconazole.